In August, a small cohort of Rollins Public Health students had an opportunity to participate in the inaugural Rollins Innovation Summit. During the summit, students worked together to address different public health challenges presented to us by industry leaders in the private sector and from nonprofit organizations. As innovation coaches, we worked in teams to develop deliverables, including a research document with background information and benchmarking related to each challenge statement. We also utilized a toolkit utilizing steps from the innovation process, a pitch deck to share solutions and ideas that were developed during the summit. And the purpose of the pitch deck was to support a pilot that was designed to test those ideas to address each challenge. It was an enriching and mutually beneficial experience for both the students as well as the attendees. I participated in the summit as an innovation coach. And next, I would like for you to meet my partner innovation coach, Zihao Leo. Zihao, can you introduce yourself and tell us your role in the summit and what led you to apply?
Sure. Hello, everyone. My name is Zihao. I am an innovation coach at the Rollins Innovation Summit. I applied to the summit initially wanted to apply the knowledge I learned at Rollins to solve real public health issues in the world, and also to have the opportunity to work with partners and clients from all different backgrounds.
I agree. There's definitely that idea about applying knowledge that I think was beneficial in the summit. I applied to the summit because I'm interested in the application of technology to addressing healthcare challenges. And I thought that by participating in the summit, it would expand my knowledge and my thinking to learn more about how to incorporate innovation in addressing public health problems. So we also have one of our attendees here with us today, Moses Olachiri from Kenya. He's the founder of the organization that Zihao and I worked with, Wellness for Greatness Kenya. Welcome, Moses. Can you tell us about your organization?
Thank you, Ebony. As you've told, my name is Moses, and I'm the founder and executive director of Wellness for Greatness Kenya. Our organization is an NGO that is focused on prevention and management of non-communicable diseases by promoting physical activity and healthy diets. One of the problems that our country is facing is that when it comes to schools, physical activity is either not happening, or if it's happening, it's not being done well. So we felt that it's important that we come up with a good approach that will engage the learners, and that's why I had to apply to participate in the Rollins Innovation Summit, and I was fortunate to get a scholarship to present our wildlife physical activity handbook project.
Thank you, Moses. Zihao, can you outline the challenge statement that you and I worked on together with Moses?
Sure. The challenge statement Ebony and I work on is to implement a new PE curriculum with increasing complexity and of exercise and animal conservation concepts relative to age and ability for learners in Kenyan school, where the curriculum is currently lacking due to the emphasis on academics and college entrance exams. To accomplish this challenge, we aim to implement a 60-minute daily physical activities handbook for the teachers that align with the Big Five and other animals for children between the age of 4 to 14 years old in order to promote physical health and having a wildlife conservation mindset.
Thank you. And to me, it was really challenging to narrow down a very broad challenge statement into something that could be piloted quickly with minimal risk. So our process involved completing background research from a variety of sources to better understand each public health challenge that was presented to us. And then we identified which piece of the entire problem we wanted to address and build a solution around. Once our focus was clearly identified, we then developed a solution for the challenge, utilizing steps from the innovation process to construct a pilot along with key performance indicators. Zihao, can you outline the pilot and the metrics we identified to assess whether the pilot was successful?
Sure. For our pilot, we plan to design a sample workout lesson plan in 2 different age groups between the age of 4 to 5 and age of 9 to 11. as a resource for the educator to guide learners in PE activities that promote love of animal and support of animal conservation, while incorporating the Kenyan's national education goals and national values. As for progress and pilot success metrics, we plan to interview 5 school teachers from where the pilot was implemented, along with 5 different students from different classes. We will interview them questions like, has the learner been more engaged in other classes? Has the learner spent more time engaging in physical activities? And for children, we tend to ask them, evaluate areas like whether the learner is excited in general to attend PE or participate in physical activities. Yes.
Thank you, Zihao. That was really thorough. I'll pose this last question to each of you, starting with Moses first. How has the approach outlined in the Rollins Innovation Summit changed the way you might approach future work? Moses?
Thank you, Ebony. The approach is actually very interesting. Initially, I thought that I will just come and meet my coaches, and then we start working on the challenge. But I was appreciated the fact that we had time to get lectures from teachers and also from different professionals who actually guided on how the pilot project is supposed to be addressed. So again, through the one-on-one sessions I had with my coaches, where they were able to understand the project very well, it was very interesting that they were able to understand the project and they can even articulate that which was in our mind and also in the mind of our Wellness for Greater staff of implementing the program.
Zihao?
Yeah, sure. And for me, I think what Innovation Summit had taught me was more than just taking on an innovative approach to solve problems, but also to be comfortable with areas or issues that I have no previous experience with. I think those are very important aspects for public health, especially because most of the time we're likely to work on issues that we don't have a previous concrete example to borrow from. And for a situation like this, we need methods like gathering research from all types of material in order to make our action plan or our challenge more understandable and to make our potential action plan more feasible. I think the approach I learned at an Innovation Summit, I will definitely use it. I will definitely change the way I work on other problems in the future. Yeah.
Thank you. For me, I realized that tackling a complex problem can be really daunting, especially as you said, Zihao, when it's something that's unfamiliar. So sometimes it's hard to know where to start, but I learned that the best approach is to break it down, start with only a piece of the problem, and then develop an idea to test that's going to be low risk. It can provide you timely feedback and give you good insight on which direction to go next. So during the summit, there was a lot of emphasis placed on how to develop, test, and measure pilot success, and that will definitely influence my future work. So thank you all for listening to our presentation today about our project. Zihao and Moses, do you have any closing thoughts?
I can say something. I really appreciate these opportunities and I really appreciate Innovation Summit. I think it's very important for public health to incorporate people and expertise from all different areas, from different disciplines. Even for me, I come from an epidemiology and numbers and biological science background, but even though I feel like the Moses topic at first wasn't really related from what I have taught in school, but really, I think using the knowledge I have learned, but using the research skills I have learned in school to apply to issues like this, it was definitely beneficial. I think public health itself requires people to come from different backgrounds in order to make a tremendous amount of progress. That's why I think much more opportunity to more exercise opportunity for students and industry leaders is important for the promotion of public health in the future. Yeah.
Thank you.
Also just to contribute to what Zihao said, I think one of the things that's actually very important is for public health, for everyone to be involved in public health. It's not something that should be left for maybe the doctors and the government. Even those people who are not in policy are supposed to participate in public health. And the most important thing actually in public health, and from what I learned from the Rollins Innovation Summit, is the aspect of innovation. If we can make something to be very interesting, if we can make a physical activity to be very interesting in schools, if we can make learners understand the importance of physical activity, then definitely we'll be able to put some of these non-communicable diseases at bay.
I agree. And I definitely agree with the sentiment that public health is something that everyone needs to actively participate in. And as Zihao said, there's a benefit to having cross-functional teams and people from outside of an organization coming together, generating new thoughts and new ideas. So it was definitely valuable for me personally, and really I appreciate having been a part of the project. If you all would like to learn more about the organization that we worked with, the website is www.wellnessforgreatness.org. Thank you.
Thank you.
Thank you.